choking infant with a LifeVac. When setting up your LifeVac, you've got your pediatric mask. Remember, this is not supposed to be used under 22 pounds. For a person under 22 pounds, plenty of stories where people have saved their babies' lives under the weight of 22 pounds. So when we use this, take your LifeVac, take your mask, you're going to place it in here, press firmly, and give a quarter to a half turn. You're going to make sure that there's still a gap inside here. You don't need to bury it all the way. The number one problem you'll see in the videos, security camera footage, body cam footage, when people are using this in real time on choking infants, choking people, is they take the mask and they just place it in like this. They place the mask on that person's face. They press down and they pull and it comes off. It's already a stressful enough situation with a choking human being. We definitely don't need to see this happen, but life is all about recovery. So the number one training point I had, the first training point, is to take that mask, place it in here, give a nice half to quarter turn and seat that mask. Okay. Infants, remember, 1 month to 12 months of age. When we're delivering our back blows and chest thrusts, we've got our 4 stages of choking. Baby's coughing severely. At this point, if you want to call 911, wouldn't fault you. Have somebody go open that front door, get 911 on the phone. Hey, somebody go get me a first aid kit. Somebody go get me the AED. Somebody call 911. Somebody get out to the street to start waving EMS down. When the first aid kit is going to get, somebody's getting that first aid kit, in stage 2, baby's still moving air, hold the baby forward. Once they stop moving air, that's when we're going to go ahead and sweep under. We've got locked in on their jaw, lock the leg in place, angle the baby down, 1, 2, 3, 4, and 5. Rotate the baby over, 1, 2, 3, 4, 5. Now I implement traditional choking first aid with the LifeVac. Most every video you're going to see, when they have a choking child or an adult, they just go straight to the LifeVac. But I like to train and teach both methods. I believe in 2 is 1, 1 is none. If you have 2 methods and 1 fails, that other method should back you up. If you only have 1 method and you're just working the LifeVac and it fails, hopefully you know how to go back to traditional methods. So at some point when the first aid kit gets to us, if we haven't cleared the airway and the baby is still choking, blue, not moving air, what we can do, lay the baby on the ground, place our mask in, twist, give it that quarter turn, and then we want to utilize what's called place, press, and pull. So at this point, if the baby's unresponsive, we're going to transition into CPR. Once this mask shows up, like I said, most people are just going straight in, place the mask, press down on the mask, push their head into a head tilt chin lift position, press down and pull, down and pull. Now, when you pull on this, you do not need to yank this thing all the way up to the ceiling like you're trying to tear it apart, right? It is literally just going from here to here very forcefully, right? So it's that counter pressure of down on the mask, head tilt, chin lift, press, and pull right here forcefully. So once the mask shows up, once the LifeVac shows up, we'll have somebody set that up. We'll have somebody set up our CPR mask and our valve. Babies become unresponsive. We're going to go into our CPR with choking as this equipment's being set up. So we're going to do our 30 compressions and 2 breaths. Remember, those 2 breaths are 1 second in length each for no more than 10 seconds. And all our goal is to see chest rise and fall. If the chest doesn't rise, not a problem. What's a problem? But we want to go ahead and attempt that second breath. After 2 attempts, we're getting back into 30 compressions. Once this gets put into order, we're going to go ahead and start to use it. So ideally, if the babies become unresponsive, we have 30 compressions. 1, 2, 3, 4, 38, 28, 29, 30. Look in the airway, see something, scoop it out. If you don't, now you have your CPR mask. I'm going to attempt 2 breaths. The chest is probably not going to rise because we have an obstruction in the baby's throat. Now I'm going to attempt 2 pulls on the masks, on the LifeVac. So place, press down on the mask, press the baby's head into a sniffing position to get them in that good head tilt chin lift, press down on the LifeVac and pull up here once and twice. Look into the device, make sure there's no food or obstruction in here. Look at the baby to see if they're breathing. If they're breathing, we're going to go ahead and take the baby, put the baby into recovery position, maintain positive control this way, or sweep under here, hold the jaw, and keep them angled forward. If we clear the airway, remember, no matter what anybody tells you, if you clear the airway, if you have a choking infant, still go to the hospital, still go in an ambulance. Now, worst case scenario, we've done our 30 compressions, attempted 2 breaths, attempted 2 pulls on the LifeVac, and the baby is still unresponsive. Been in this situation plenty of times, professionally and personally. Don't freak out, auger in, get back to 30 compressions, look in the airway, 2 breaths and 2 pulls. So 1, 2, 23, 28, 29, 30. Look in the airway. I don't see anything. I attempt 2 breaths. Chest isn't rising because the airway's still blocked. Grab my LifeVac, place, press, pull. 2, no object in here. I don't see the baby breathing. 1, 2, 3, 4, 28, 29, 30. Look in the airway. 2 breaths. I don't see the airway rise. Place, press, pull. All of a sudden I see an object in here. Baby starts to cry. At the point that the baby starts to cry, remember, place baby in recovery position here. Sweep under, hold baby here. Keep the airway angled forward so that we're helping using gravity in our favor to help that stuff drain out of the baby's mouth. Now, real life scenario with me and the crew I was working with, one of the most complicated choking situations we had with a child, 5-year-old little girl. We received a message on our MDC, our dispatch terminal in the rig. It said that sheriff was on scene and child was unresponsive and blue, literally as blue as this. Little Asian girl, about 5 years of age. She was sitting in a chair at an office with her mom eating grapes. She simply sat out of the chair. Once her feet hit the ground, that grape got lodged in her throat. She was that 1 in 5 children that would have died had we not shown up with secondary measures, because traditional choking relief measures, traditional choking first aid failed. The sheriff, mom, all the other folks on scene were trying back blows, chest thrusts, Heimlich, everything they could do, and it all failed. She was as blue as that bag. I turned left into the parking lot. There were a bunch of people in the parking lot. Sheriff literally hands me this little girl who is blue and limp. I kind of lost it for a second. The wires were a little bit crossed. Very stressful. Regained my composure. I did try back blows. I tried Heimlich. As my partner is getting out of the rig, bringing the equipment around, I laid her on the ground. As I had her in this position here, he hands me, once again, this child was going to be one of those one child that dies every 5 days. Traditional methods failed her. She was that 20-30% where traditional choking first aid failed, and she needed a backup. I truly believe this is the backup that can fill that gap for you until you're waiting for EMS. So we grabbed our paramedic tools, and I got down on the ground, head to head with her, scooped the laryngoscope in, lifted her throat up, and I looked down into her throat, and I could see a large green grape. I reached in there with the McGill forceps, which are curved tongs and pliers. Do not buy these things. You are not protected under Good Samaritan to use them, and you will probably injure or catastrophically injure or possibly kill that person because you're not trained on it. I pulled that grape out, and the reason I tell this story is because there's a huge difference between this tool and the tool we use as paramedics. As I pulled the grape out, she didn't start breathing. I think in almost every single video I've watched of adults, children, and infants where folks go straight to this device with an unconscious child, as soon as they place, press, push, and pull, once or twice, maybe the third time, the object comes out and that person starts breathing and crying immediately. With that little girl, she didn't start crying. We proceeded to start an IV, continue 30 compressions, 2 breaths. My buddy is giving her epinephrine. We're performing CPR. We're bagging her. Mom is screaming in the way that only a mom can scream as she's sitting here watching her blue and dead child have CPR performed on her. There's probably 30 or 40 people in the parking lot. Sheriffs were on the phone. Sheriffs were the dispatch. Sheriffs talking to the captain. Hey, we're going to block every intersection on the way to the hospital. We worked on this little girl for 2 minutes, roughly. And at some point, her eyes pop open. And in the meantime, I actually looked at mom, who was screaming hysterically. I said, hey, come over here. And so she got right down here on my left side, face to face with her daughter, and was talking to her unconscious daughter who was in cardiac arrest, telling her, hey, I said, hey, tell her to come back to the light. Tell her to wake up. Tell her everything's going to be okay. Tell her mommy's here. So as mom's talking to her, the crew's working her with compressions. I'm bagging the baby, the little girl, trying to giving her ventilations. After about 2 minutes roughly, her eyes pop open and she just starts this monotone cry. So the idea here is that with a lack of oxygen to the brain, you're going to incur what's called an anoxic brain injury. She was probably at about 6 to 8 minutes. Usually you're towing the line of possible brain damage to permanent brain damage. Her cry was just a straight monotone cry. Very concerning. We pick her up, put her on the gurney. I'm up here managing her airway in the ambulance. Mom is still talking to her. My buddy's managing the IV, the cardiac monitor. Police are rushing down the street at 80 miles an hour. Every intersection shut down. We pull into the ER, drop the baby off, drop this little girl, not a baby, 5 years old, drop this little girl off. And she still just had that monotone cry. We head back out. Unfortunately, my partner, my buddy, paramedic partner, he had a daughter same age, and we got all of our equipment. We're receiving multiple calls, and we've got other calls going on in our jurisdiction. We've got equipment in the ambulance, equipment on the paramedic squad. So we missed a few calls because we had to get our stuff gathered back up. It tore our hearts out. Like, it was really hard to hear because that cry, the way she was responding, she was not tracking, she was not responsive. It was just a monotone cry. It appeared she probably had some brain damage. Little end of the story here is that she made a full recovery. So, but in this ER at the time, at some point, I looked at my buddy. I'm like, hey, man, we've got multiple calls in the area. Our gear's back up in gear. Our gear's back in order. We got to get going. So we took other calls, and he had to work for 2 more days for a total of 3. He did not get to go home and see his daughter, right? And it just crushed him. He actually happened to make drop a patient off at the hospital she was at. He went upstairs, spoke with the family, and after speaking to her, he actually, it was kind of a crazy story. She was still somewhat off, hadn't made a full recovery yet. She looks over at him. He asks mom and dad, hey, can I show her a SpongeBob video on my phone? Walks over there, shows the little girl the SpongeBob video. She makes eye contact with my buddy, and all of a sudden she just smiles and perks up. Don't know how that all works out, but she made a full recovery. We kept in contact with her for quite a few years, became a ballerina, lived a full great life, and she's still out there living a great life. I tell that story, which is really, really hard to tell, hard to deal with, but it's a reality. And we've treated multiple other kids like that. The only thing that saved that little girl's life was a secondary device. It wasn't this. It was paramedic equipment with high level of training. And I think this fills that gap. I think this is a secondary device that can make the difference while you're waiting for EMS and you're incorporating those 30 compressions. Look in the airway, clear it object if you see it, attempt your 2 breaths. If those do go in or don't go in, if they don't go in, then attempt your LifeVac because you still know that the airway is obstructed. 30 compressions, look in the airway, 2 attempts here, 2 attempts here, and just keep working the process. Once the airway is clear and you do have good rise and fall of the chest with your mask, you can take this and place it to the side because you know the airway is clear. If the baby is not breathing on their own and you do have good rise and fall of the chest with this, they are in cardiac arrest. We're just going to maintain 30 compressions and 2 breaths. Once the baby starts to breathe on their own, that's where we're going to bring baby up into that recovery position, sit them forward, keep them on their side, and let gravity work. Make sure you go to the hospital.